Can watery discharge before a period be a sign of an infection?
Hey everyone, welcome back to our channel. In today's video, we'll be discussing a common concern that many women may have. Can watery discharge before a period be a sign of an infection? We'll explore this topic in detail to provide you with a better understanding. So, let's get started.
Understanding watery discharge.
Before we dive into the question at hand, let's first understand what watery discharge is and why it occurs. Vaginal discharge is a normal and healthy part of a woman's menstrual cycle. It can vary in consistency and color throughout the month, depending on factors such as hormone levels, hydration, and sexual arousal. During the menstrual cycle, the discharge can change from thick and sticky to thin and watery. This is usually a result of hormonal changes that occur before ovulation. The purpose of this discharge is to help facilitate the movement of sperm through the reproductive tract, increasing the chances of fertilization.
Normal versus abnormal discharge.
Now that we understand that watery discharge is a normal part of the menstrual cycle, it's important to distinguish between normal and abnormal discharge. Normal discharge is typically clear or slightly white, odorless, and doesn't cause any itching or discomfort. However, if the discharge becomes thick, clumpy, greenish, yellowish, foul-smelling, or accompanied by itching, burning, or irritation, it may indicate an infection or other underlying issue. In such cases, it's important to seek medical advice for a proper diagnosis and appropriate treatment.
Infections that can cause watery discharge.
While watery discharge before a period is usually not a sign of an infection, there are some infections that can cause changes in vaginal discharge. Two common examples are bacterial vaginosis, BV, and trichomoniasis. 1. Bacterial vaginosis, BV. BV occurs due to an imbalance in the vaginal bacteria, leading to an overgrowth of certain types of bacteria. Symptoms may include thin, grayish-white discharge with a fishy odor. 2. Trichomoniasis. Trichomoniasis is a sexually transmitted infection, STI, caused by a parasite. It can cause frothy, yellowish-green discharge with a strong odor, along with itching, irritation, and discomfort. Remember, each infection can have unique symptoms, and it's crucial to consult a healthcare professional for an accurate diagnosis if you suspect an infection.
Other possible causes.
It's important to note that not all changes in vaginal discharge are necessarily due to infections. There are several other factors that can influence the consistency and appearance of the discharge, such as hormonal changes. Fluctuations in hormone levels, especially during the menstrual cycle, can affect the discharge. Sexual arousal. Sexual arousal can increase blood flow to the vaginal area, leading to increased discharge. Hydration. Dehydration can result in thicker discharge, while proper hydration can make it thinner. If you're experiencing changes in discharge that are concerning or causing discomfort, it's always best to consult with a healthcare professional to determine the underlying cause. To wrap up, watery discharge before a period is generally a normal occurrence as a result of hormonal changes. However, if the discharge becomes abnormal in color, consistency, or is accompanied by other symptoms, it may indicate an infection or underlying issue. It's essential to pay attention to any changes and seek medical advice if needed. We hope this video has helped answer your question. If you found it